Maria Holder Diabetes Center.
Managing diabetes means treating the whole patient, not just blood sugar.
It is time for the first 15 diabetic-friendly minutes that you will hear on VOB for the month of July, all with the compliments of the Barbados Diabetes Foundation.
I will be interested in hearing what will be spoken about in today's show.
Let's see who's spoken today. In today's show,
what exactly is exercise? Because we have different concepts of what exercise can look like. And why does it matter to us as humans or to persons living with diabetes?
Dr. Diane Brathwaite speaks with the new consultant physician with the Maria Holder Diabetes Center, Dr. Curtin, on the benefits of exercise if you are diabetic or even if you are not diabetic. You need to listen.
So there's some people who think you can tell if your blood sugar is high based on how you feel.
GM Marshall White has some warnings for you if you feel you can tell how high your blood sugar is. All of this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Ice Screening Program, and the bank that will not raise your blood pressure because they will help you achieve your financial dreams. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
A happy, healthy Saturday morning, VOBers! Peter Boyce is in the VOB house for another healthy session that is especially targeted at diabetics and pre-diabetics, reminding you about the Maria Holder Diabetes Center. You can find them in Warren St. Michael. They're your one-stop shop for all of your diabetic needs. They are good for your physical health and also your financial health because they have got some good prices that will not break your pocketbook, and those good prices get better when you use your BARP card. So where's get discounts off of so? You might be home drinking your tea, listening to VOB and asking. You get discounts off of eye screening for diabetic retinopathy. Every year, that is something that you must do if you are diabetic. You get discounts off of vascular screening.
You mean that's like when you first swell up?
Exactly. When you might have venous insufficiency or what Bajans call bad circulation. And then you can also get dietitian Victoria Cox to give you diet advice. And also Dr. Diane Brathwaite up there too, and she could give you a good checkup. And there's also a new doctor, Dr. Kristen Curtin. You know Dr. Curtin? Well, you will know her by the time we finish this show. So call and make your appointment at the Maria Holder Diabetes Center. Get something and write the number down.
243-3937.
And don't forget to take out your BARP card.
The Maria Holder Diabetes Center.
It's time for another exciting episode of Mythbusters with GM Marshall White. It's Medical Mythbusters! You feel it, so?
Somebody tell me.
That's what they say.
Oh, you see it on the internet? But what really is the real truth, though?
This is Medical Mythbusters with GM Marshall White. The truth is here.
Hey, Alfonso!
Yes, Mildred?
You check your blood sugar recently and see how high it is?
Mildred, if my blood sugar was high, right, I'd be able to tell. You feel as an idiot. I know how I feel.
I don't know about that. Let me find out what General Manager of the Maria Holder Diabetes Center, Miss Marshall White, got to say about that.
So there's some people who think you can tell if your blood sugar is high based on how you feel, but symptoms are not always reliable, and many people have no symptoms even with dangerously high blood sugar. I can't stress enough that regular blood sugar testing is essential for accurate monitoring.
Thank you, GM Marshall White, for coming and educating the VOB people and me on how to be careful with our health as we move on to our next segment. And this morning we are dealing with exercise. And anyone who knows me know I like exercise bad. Let's take a listen to Dr. Diane Brathwaite and Dr. Kristen Curtin.
Hello, good morning. Happy Saturday here to you again. Yes, June is over and we talked about Men's Month and men for the whole of June. One gentleman reliably informed me that men's season goes until crop over, and I won't tell you why, but men, we're not forgetting you. Everything we're discussing can be still applied to you. And in fact, I have a little joke for you. You know I love my jokes. Hi, good morning, Peter. Good morning, Alfonso. Of course, my favorite. Oh, I won't even say that word. You may get offended, but my favorite non-human.
There's nothing wrong with calling Peter Boyce non-human, Dr. D. You don't like an alien for true, because that's who you got me. Continue.
So I have a joke. So I saw a gentleman just now and I said, sir, what are you doing to get exercise? He told me getting out to bed every morning is enough exercise. And I was like, no, it isn't. So then, of course, today I couldn't help but run down the hallway and drag Dr. Curtin down here. So I'm going to say welcome to Dr. Curtin, our new consultant physician in the Diabetes Center. And we're going to talk to you about exercise. Good morning, Dr. Curtin.
Good morning, Dr. Brathwaite. Thanks for having me. How's everybody doing?
Well, I guess everybody must be okay, and it's Saturday, so we good.
Of course you are. Of course you are.
I'm always good. So I just wanted to, let's just get a bit more into exercise. We're actually going to spend the month, some little time within the next month talking about exercise in more depth, and it as one of the key pillars of lifestyle management and lifestyle maintenance. First of all, what exactly is exercise? Because we have different concepts of what exercise can look like, and why does it matter to us as humans or to persons living with diabetes?
So I think that's a good way to kick us off this morning. So there's exercise and there's physical activity. So physical activity is any movement, any bodily movement that we do that causes you to expend energy. So raising an arm, kicking a leg, that's physical activity. However, when there's structure to it, so there's planned, structured movement, and it's geared towards a specific goal, and that goal could either be weight loss, that goal could be changing body composition, so say you want less fat, more muscle, that is when it becomes exercise, something repetitive, something structured, and something geared towards a goal. So yes, we want you to increase your levels of physical activity, so that might mean parking further from the office door, getting up and walking a little bit more at work. That's all physical activity, but when we talk about exercise, we want it to be planned, we want it to be structured, and we want it to be focused towards achieving something. And if we're talking about diabetes, we're talking about reducing your blood sugars, reducing your cholesterol. It can even reduce your systolic blood pressure, which is that top number reading that you get whenever you check your blood pressures. So that's what we're talking about, exercise.
Right. So I think exercise is an interesting topic for several reasons. And why I say that is because I think it's something that we did a lot more previously, and in this current world that we live in, our current workplaces, we do not exercise enough. And I would say that it is, and even with just like the electronic devices, so I think there is less exercise throughout the lifespan generally for a lot of people, from childhood all the way up to elderly. So today what I think we're going to focus on is we want to focus on a specific kind of, I think, more like age bracket, and we're going to look for a moment at the older person. Dr. Curtin is so humble. She hasn't even said that she actually has a specialty in exercise. What exactly is your specialty in exercise?
Good question. So my specialty is in clinical exercise physiology. A lot of words to say exercise prescription for persons with clinical conditions. So it's an exercise doctor, so to speak. And what we do, we look at the types of conditions persons have, the types of age that we might come across, so the younger the older, and we modify the exercise prescription to suit. And that is something that I've fallen in love with. It's always a challenge trying to figure out the best exercise to do to suit a person's clinical condition. So for example, how do we modify the workout if you have reduced sensation in your feet from the diabetes, right? How do we modify the workout if you have eye disease from the diabetes? How do you modify if you have Parkinson's disease as well as diabetes? So there's a lot to it. It gets fun for me on my end in terms of design, but it also gets encouraging for patients because they find out, hey, I can do something. It just needs to be approached a different way.
Thank you for that information, Dr. Kristen Curtin and Dr. Diane Bradford. You listening to VOB. To get more information on how exercise can benefit you, call and make an appointment at the Maria Holder Diabetes Center as we go into our Saturday song of the day. And all that talk about exercise, this is an exercise song to make you jog around the house this Saturday morning. This is Serenada with Jogging. Compliments the Maria Holder Diabetes Center and Republic Bank.
Me as a politician went jogging. Suddenly, like Ben Johnson, all they start running.
The Maria Holder Diabetes Center.
It was too hot for me, so I slowed down. In a short space of time, all them ran down bridge down. Look the road that they took me bathing so damn confused. The only trail where you look was stops on their shoes. Richie saw the tax and he changed his direction. 3 others followed, causing chaos and confusion. From the transport road to Belpenetry ahead. Teachers outside St. John's Secondary said. Frustrated people by NHC said. And folks were fought by the casualties said. Would you call that jogging? Which one of them running?
The Maria Holder Diabetes Center.
Another service which is available at the Maria Holder Diabetes Center is vascular or ABI screening.
Who should get the screening, boy?
Persons living with diabetes, persons who experience pain while they are resting, or a burning pain sensation in their legs or toes. If you have what is called bad circulation, if that sounds like you might need this vascular or ABI screening test. Let's hear what vascular spokesman Donald Clark had to say.
I should indicate that this is not a male-only condition because of erectile dysfunction, but female condition as well. Ladies with varicose veins have their condition to have this ailment. So I would want to say that women should also have this test done. Again, peripheral artery and peripheral vascular, which is different because arteries are arteries and veins are veins, but varicose veins is a telltale sign that there's a problem with peripheral vascular disease. In men, of course, it's erectile dysfunction. That is major. That's how you tell that there's a problem. That's how men would normally tell that there's something going on, there's no blood flow, or there's, I should say, reduced blood flow to the penis, of course, but in women, varicose veins is a telltale sign that there's also a problem. Peripheral artery disease, it's a simple test. It's called an ABI test, and I can't stress enough the importance of getting this test done.
Cutting-edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
Lifestyle changes can be just as powerful as medication in controlling diabetes.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
The Maria Holder Diabetes Center.